the myths about pathologists is that we are not involved in patient care. That really is a myth that needs to be exploded. Pathologists are involved in patient care. Pathologists may not have as much direct contact with patients as other physicians do, but everything taken out of a patient, whether it's a sample of blood or urine or tissue, comes to a pathologist for analysis and for a diagnosis. Over 80% of diagnoses made in a hospital on a patient are dependent on the pathologist's verdict. Any tissue taken out of the pathologist is examined in detail and a decision made as to what its underlying or patient's underlying disease is. Not only that, pathologists participate in clinical rounds where discussions about patients are held. Pathologists participate in tumor boards where all the individuals, all the physicians involved in the care of a patient are present, and it's the pathologist who decides that the patient does have cancer or doesn't have cancer, and the treatment follows on the type of cancer, degree of spread, and the other tissues involved or not involved. One of the things that would help a pathologist significantly would be to get patients' consent for ancillary studies. One can look at one sample and decide what the nature of the disease is, but one needs to be able to go back and analyze a whole bunch of patients with similar cases, similar diagnoses, to be able to come up with the broader guidelines necessary for public health. For this, tissue needs to be banked, and for appropriate banking, the patient should have given consent prior to the tissue being taken out. Getting consent after the fact is much more difficult since most patients go home.